Once the operation is over and you return home, there are several things to keep in mind. These post-operative instructions are important for speeding the healing process and avoiding any complications. Sarah is one of our exceptional nurses here at the Midwest Specialty Surgery Center, and she'll discuss these post-op instructions in more detail.
Once surgery is completed, one of the post-op nurses will go over all discharge instructions with you and your family. The family member that is here with you will be your memory for most of this information. All of the patients that receive a total joint will go home with additional equipment to aid in your recovery and healing for the first couple weeks. All patients will be instructed to wear stocking hose or TED hose on both legs for 24 hours a day until your first follow-up appointment. That appointment's around 10 to 14 days after surgery. These hoses are important in minimizing swelling and decreasing your risk of blood clots. Please be vigilant in wearing these stockings at all times. The only time these should be removed is if you are taking a shower or if the hose are being washed. Over top of the stocking, you will be given a machine, an SCD or leg squeezers. These are also very, very important to help decrease your risk of getting blood clots and reduce the amount of swelling you have. These leg wraps are to be applied to the lower leg below your knee with the Velcro closures in the front and the pillow pocks on the back. These should be put on snugly so that the machine that runs them can inflate them and apply pressure to your lower legs. This machine will run on battery for up to 6 hours, and if you have a car ride over 1 hour, you will be asked to wear these on the ride home. Usually these are worn at home anytime that you are not moving. They will be need to wear on both legs, and anytime you are sitting, watching TV, napping, or sleeping at night are all times that these should be on. Most people will need an extension cord for their bedroom to allow for easy plugging of this device at bedtime. All patients will go home with an icing device. For our knee patients, you will receive an ice wrap that is a gel wrap, and there are 2 of the blue inserts to allow you to switch them to always have a new one. For our total hip patients, we do ask the easiest way to ice is usually frozen vegetables. They're small and moldable so that they fit where you need to do it. All of our patients will be responsible for doing your own dressing changes at home. Usually your first dressing change is around day 3. Each person may be individualized and have changes, so please refer to your discharge instructions for specifics about the date of your change. You may need to get more gauze, as we only send you enough gauze to last usually the first week after surgery. The easiest way to restock your gauze is to take 1 package from each piece of gauze to the pharmacy and ask for assistance. You will be notified during your discharge if you are allowed to get your incision wet or not. Usually around the time of your dressing change, you are allowed to take a shower. Most patients will require to keep this dry, and the best way to do that is to use a roll of press-and seal made by Glad that you can get from your local grocery store. It's sticky on the back, so it will seal up nicely. You just wrap it around any area of incision. During your first shower, we do ask that you have an adult in the bathroom with you the entire time you're in the shower. This is for safety. If you get dizzy or weak, you have someone immediately to help you get out of the shower and sit down. Once you've completed a shower and you do not have any issues and are not requiring the use of the second person, you are allowed to shower without any assistance. Please use your judgment and be safe as you can. Once here, you've met all the requirements for discharge, which are eating, drinking, walking, and using the restroom, you can be discharged. Once you're ready to go, we will take you to ATI Physical Therapy for a quick 20 to 30 minute evaluation and instruction session. During this session, your family will be present to learn the exercises you will need to do at home for the first couple weeks. This visit will also aid you and your family in knowing the safest way to use your walker. The staff will fit the walker to your height, make sure you know proper movements with you, and show you how to maneuver stairs. At this time, our surgeons do not routinely send patients to physical therapy outside of the home prior to your first follow-up appointment. Most patients will complete therapy at home with the list of exercises that they're given at the ATI visit. All patients are evaluated by the surgeon's team at their follow-up for their progress and wound healing. At this follow-up appointment, it will be decided between you and your surgeon if therapy is needed or if you may simply continue to do therapy and exercises at home. Upon completion of your therapy visit here, you will be helped into the car and use the pillows to get you comfortable for your ride home. During your stay with us, we've done multiple things to aid in your pain control to assist you in getting home, getting settled, and having time to get food in your stomach before you will begin your pain meds. Some patients will get a dose of pain medication here prior to discharge, but please plan so that you can have your medications filled on the way home, as everyone is instructed to start taking their pain medicine the day of surgery before bed. Most patients will get an additional medication list from the surgeons to take over the next 30 to 60 days after. Some patients will have these prescriptions called into their pharmacy prior to surgery. If this occurs, feel free to pick them up, but please do not take them, as they are not for before surgery. They are for after. Medications you're going to be given are for nausea, stool softener, aspirin or something based on your history, and a nighttime pain medication. You'll also get an antibiotic that you will take 4 doses for the first day after your surgery. The day of your surgery, patients will receive narcotic pain medications. These will need to be filled on the way home. All patients will be given a follow-up date and time for their first appointment the day of your surgery. Please plan to have a driver for this appointment, as most patients are not ready to drive. This follow-up appointment is for wound check, therapy assessment, and generalized questions and answers. Please know that following your surgery, one of the nurses at the surgery center will call you and see how you've been doing, and also the surgeon's staff usually contacts you 1 to 2 days after your surgery. If at any time after your surgery you have questions, please don't hesitate to call us. All patients should contact the surgeon if you are having fevers, bleeding through your dressing, warmth or redness on your leg, odd-colored drainage, or if you are vomiting and unable to hold fluids or medications down. The direct number for the surgery center is found in your binder on the front left-hand side in the blue pamphlet. We are here during normal business hours, and you are welcome to call us. If you have any urgent or specific needs or questions directly for your surgeon, please contact the surgeon's office directly. The surgeon's office is the number to call for any after-hour needs. If you have any questions or any concerns, please don't hesitate to call either phone number and we will find the answer for you.